I'm delighted. My name is Sharon Parkinson. I'm Health Promotion and Improvement Manager. I'm delighted to welcome you all here to the launch of the Wellness at Work toolkit. Thank you all for your time this morning. There's, I suppose, the toolkit is one of a number of initiatives that have been put in place by the Wellness at Work Committee, which is a subgroup of the Healthy Ireland Compass implementation group. Staff health is a key priority for us, and it is a key priority for Cork Kerry Community Healthcare. And as I said, this is one of a number of initiatives that's in place, which is testament to the work and enthusiasm of the Wellness at Work team, which have organised the event this morning. So I will be introducing the team who are going to talk you through the content of the toolkit, and also will highlight for you a number of the other supports that are there in Cork Kerry Community Healthcare to push the agenda of promoting our health in the workplace and creating a healthy workplace. So I'm now going to hand over to the team who will introduce themselves.
Hi, my name is Brosnan and I'm responsible for staff health across Cork and Kerry.
Hi, I'm Maura Leary. I'm Health Promotion Officer working in staff health team, but also a Sexual Health Promotion Officer, and I'm the face behind the newsletter. So hi, everybody.
Good morning, everyone. My name is Caroline O'Callaghan and I'm the Healthy Ireland lead in the Disability Services sector.
Hi there, my name is Katrina Canty and I am the Healthy Ireland lead in mental health.
I'm not sure if Anne-Marie is gone there. My name is Edel O'Donnell. I'm Health Promotion Officer in the Department of Health and Wellbeing, and I have a brief in staff health and also in sexual health, and delighted to be here.
Thanks, Adele, and thanks everybody. I just want to congratulate you all on a really huge and successful piece of work. Just to say, we've a committee in place for a couple of years, and there's been a huge emphasis on staff health for a number of years under health and wellbeing. And as the chair of the group, I have experienced huge enthusiasm, great ideas, and I suppose as a team, we're really keen and delighted that you're joining us this morning, because we've produced a lot, but we can't, I suppose, deliver on what we do without engagement with yourselves. So thank you for joining us, and we look forward to today is just, I suppose, an introduction, and we look forward to engaging with you in the future. Now, before we move on, I just have a few housekeeping pieces just to let you know that the event is been recorded this morning, and that for yourselves, just in terms of the best view, if you go to the top right hand corner, I think it's oh yes, if you select the top right hand corner and use speaker view, that's the best view. And also, just in terms of, there isn't much background noise at the minute, but if you could all stay on mute, that would help us in terms of a smooth running this morning. Okay, thank you very much. So next, I would like to introduce Priscilla Lynch, who's our Head of Service for Health and Wellbeing. Priscilla, like I said, the management team very much prioritise our staff health, and there's a huge amount going on at the moment. So thank you very much, Priscilla, for taking the time to join us. And Priscilla is going to officially launch our toolkit this morning. Thanks very much, Priscilla.
Great. Thanks very much, Sharon. Good morning to everybody. I'm absolutely delighted to be here. Promoting health is everybody's business, and the role of health and wellbeing personnel is to help us all to do that. And most of you on the call will be aware that people spend a third of their day at work. I think that always just astounds me when we think about that, a third of our day in the work environment, and how that has a significant impact on all of our health, particularly the COVID crisis has been extremely challenging and has been very, very difficult for health services over the past 12 months in terms of what we've faced. And as a consequence of that, that has had a significant impact on all of us as healthcare workers. I suppose one of the best ways for us to be able to support each other and support the agenda of staff health and well-being is to set up a Wellness at Work committee. The work undertaken by the team that you're going to get an overview of this morning has been very much aligned, as Sharon has said, with not just the national priority programme in terms of the delivery of a healthy work environment and promoting staff health and well-being, but it certainly is a significant priority for us here in Cork and Kerry, and is aligned to our Healthy Ireland Compass implementation plan. The resource Healthy Ireland Compass, a toolkit for a Wellness at Work committee, is a step-by-step guide in terms of setting up a successful Wellness at Work committee in your workplace. I really have to say a huge thank you to all the members of the Wellness at Work team. They are so passionate. They are so hardworking, and they dedicate so much of their time to delivering a suite of resources and initiatives and supports for all of you as workers right across the services. You're going to get a great overview today in terms of this wonderful resource that they have built in order to support us all. So without further ado, because we want to spend the time this morning in terms of actually hearing all about this resource, I'm absolutely delighted.
Come down here and he did something with the computer.
Yeah, but that was the first time. This time you don't have to do, because we had it yesterday.
You need to unmute yourself again.
Thank you, Ailish. Thank you so much. So without further ado, I am absolutely delighted to officially launch the Healthy Ireland Compass Toolkit for the Wellness at Work Committee. And I'll hand over to Ailish. Thank you so much.
Thanks so much, Priscilla. I really appreciate that, and thank you, Sharon, as well. So now that you have kind of a good sense of who we are, hopefully, we'd love to know who you are and what motivated you to attend the webinar today. Maybe you're here because you're on a Wellness at Work committee. Maybe you're just interested in staff health. Maybe you've participated in some initiative in your workplace, or maybe you're just curious about the toolkit. So if you could pop in the chat box and the reason you're here, that would help us kind of gear the webinar for you as well today, and you'll help you get the most out of it. So you'll find the button for the chat box at the base of your screen. So don't be shy, and pop in your reasons there why you're joining us today. So while you're doing that, just to give you an overview of what we'll be covering in the webinar, we've done the introductions. I'll be talking a little bit very briefly about why staff health and well-being, and Priscilla and Sharon both address that to some degree as well. Adele is going to talk a little bit about what an ideal healthy workplace is and how that links to the World Health Organization framework. Then I'll be giving you a walkthrough of the Wellness at Work toolkit so you can get familiar with it and the content and how it can benefit you and your committee. And we'll talk about what other supports are available aside from the toolkit. As Priscilla mentioned, there's quite a few supports out there for you. And we'll discuss the wellness champions and give you all an opportunity to become one of those. And then we'll have a little breakout room where we can hear from you and get a sense of what the best next steps are, how we can best support you moving forward. And then hopefully after all that, we'll have some time for Q&A as well. So that's the sense of what we're going to be doing. So I'm just going to check into the chat box there and get a sense of why you're all here. So some of you are members of health promotion groups, some of you are curious about the toolkit. Fantastic, part of a wellness committee in Kanturk, welcome. Want to be able to relate back to community groups, great. Okay, so lots of you are already on committees, so that's great. And others are interested, fantastic, fantastic. To build morale and support, absolutely much needed at the moment. Brilliant. Thanks so much for sharing all that. It gives us a good sense of what you're wanting and why you're here as well. Fantastic, great engagement there, so thanks for that. So just to kick it off, just a reminder, just if you can all mute yourselves as well and while you're listening in, just so it makes it a little bit easier for all of us. And we'll get going with the staff health and wellbeing piece. So really, you know, why staff health and well-being, you know, as it says here, health is created and lived by people within the settings of their everyday life. So it's wherever we are. And as Priscilla said, a lot of that time, a third of our lives are spent in work. It equates to, I think, about 90,000 hours. So a lot of time. So we really want to find ourselves in an environment that supports our health. And that's why we're doing the work that we do. So for those of you who I suppose in terms of, you know, the benefits of staff health and well-being to the organisation, there are many benefits. And for any of you who've mentioned you're already part of a wellness committee or involved in staff health initiatives, I'd love you again just to pop in the chat box. What are some of the benefits you've gotten from being involved in these, whether it's as a participant or as an organiser? What are some of the benefits you found from the staff health initiatives you've been involved with? So just pop some of those into the chat box. So from an organisation perspective, you can see the benefits listed here, and there are many, you know, increased employee morale, reduced staff turnover. From the HSE perspective, probably the reduced employee sick time is one of the biggest ones. You know, according to an ERSI study, the health sector had the highest number of days lost per worker due to work-related illness compared to any other sector here in Ireland. So absenteeism is a big issue. So from an organisation perspective, there are many reasons we should be engaged in this. But obviously from a staff perspective, there are many more reasons as well. And particularly if we consider, as Priscilla highlighted, that the past year, you know, what staff have had to endure. A recent study from NUI Galway, just there in January, was reporting that healthcare workers are experiencing higher rates of anxiety, stress and depression due to the pandemic. And that even long-term trauma issues are starting to manifest now as well. So now more than ever, staff health really should be top of the agenda. And, you know, as you've all been, you know, many of you have been involved in staff health initiatives already, you know the benefits. I know for me personally, being involved with Where it's that sense of, you know, getting to know colleagues I wouldn't know otherwise through the choir. It's, you know, having those lovely chats in the lunchtime walks. It's the buzz in the canteen when we're giving out the Steps to Health challenge prizes. You know, it's all those kind of things that we really need at the moment, that connection, that social interaction, all those benefits we need for mental health. And just looking at the chat box as well, these are some of the things exactly that you're coming up with: connection with each other, stress control, you know, all those reasons that are to the fore now more than ever. Good mental health, morale boost, exactly. So exactly what I'm saying. And I'm glad that you're all experiencing those. And for those of you who are new to wellness at work or thinking about it, you can see the many benefits that can come from it. So now I'm going to pass you over to Adele, who's going to talk you through what an ideal healthy workplace is.
Good morning, folks. So just for the next few moments, I just want to get you to start thinking about what a healthy workplace looks like. So I'm going to do that through a visualization first. Then I'm going to split you into breakout rooms. Now, anybody who knows anything about health promotion, we love breakout rooms and getting people to talk to each other in small groups, because that's a lot of the rich stuff gets done in the small groups. So the visualization will only take about 2 minutes. Then we'll go into breakout rooms. I'll talk to you about that. Don't panic when the breakout rooms, when you're broken into the room, just wait. All of that sort of stuff will be done in the background. So the toolkit, which Eilish is going to walk us through very quickly after this, is a very pragmatic toolkit for you. And I just want to situate the toolkit in the broader context of health promotion in general, and a settings approach to health promotion, which is really important in the health promotion community. So what I want you to do is just settle into your seat, just relax. And if you feel comfortable, close your eyes. You don't have to. You can turn off your camera if you want to as well. And just for the next few moments, just settle in, close the eyes. And I'm inviting you to go on a short health promotion journey into a workplace that is health promoting in every way. So I want you to imagine this workplace and imagine approaching this workplace where staff health and health promotion is valued, promoted, and actively supported by all at every level. So maybe first of all, approach this workplace, this building site or this campus from the outside, just looking at it from the outside. And what do you see that marks it off as a place where health is promoted and where people are healthy and happy in their work? So just take a look at this workplace and what evidence is there? Notice the surroundings, the colours, the space and the light, the facilities, the people. So basically the built environment and the natural environment. And just keep notes in your head about, oh yeah, this is a healthy workplace. This looks like a healthy place to be. What's the evidence? And then maybe going into the building in particular that you're imagining. And so I want you to move around the building, and it's as if you're invisible. Nobody can see you as you move around. And just check out what the relationships are like, how people are with each other, how people engage, the walls, the light, again, the space, what you can hear, what you can see. Slowly moving around this workplace as if you're invisible, gathering evidence that I'm walking around a workplace where health is valued and prioritized and practiced, and where people are generally happy in their work. So just keep some of those observations in your mind. Maybe jot them down if you have a chance. What were the signs that this place was a healthy place to work? And now if you can just come back, open your eyes if you've had them closed, turn on your cameras if your cameras have been off.
Inside the building, we felt, again, a space, a sense of space, brightness, positive messages, and just a sense of good interactions and a good vibe within the building.
Great, thanks. Thank you for that, Caroline. I'm not sure, Maura, if you were in a room there, if you could give us feedback, if you were taking the feedback, Maura O'Leary.
Absolutely, yeah. I was in a room
Maura.
there. So I suppose a lot of stuff that Caroline has mentioned again, and a lot of it was around, I suppose, the physical appearance, you know, the trees, nice places to sit, having the picnic benches, you know, having the walls nice, bright, airy, some nice artwork maybe on the walls, but also then I suppose there was stuff around the atmosphere, you know, having a nice culture, a nice place to be, you know, a warm atmosphere, you know, where people are getting on. And then I suppose related to that's kind of like the policies around the dignity at work, that kind of stuff. And I suppose then we were talking about, you know, then there's the signage and stuff, making it visible that we actually know that this is a kind of a healthy workplace, you know, like, so maybe take the steps instead, or take the stairs, you know, instead of the elevator, and just having it very visible, having your high Healthy Ireland stuff up around the place as well. Bike racks outside so that people can actually, like if they do cycle to work, that they have somewhere to actually to put the bikes and things.
Okay, and that's kind of, that's taken into account. Okay, we can move on. Eilish, thank you so much for that. We didn't hear from everybody. We want to get onto the toolkit, but thanks for the work in the small groups. So just I suppose the wider context, putting all of that into the WHO Healthy Workplace Framework. Just reading the slide here, a healthy workplace is one in which workers and managers collaborate to use a continual improvement process to protect and promote the health, safety and well-being of workers and the sustainability of the workplace by considering the following based on identified need. And I suppose the main things there would be that it's a continuous process. It just isn't something that you arrive at. Health promotion is a continuous journey. It's a process. It's a collaboration between managers and workers. And I can't stress enough the really importance of getting managers on board for this work. It's also based around need, that it's really important to do a small needs assessment again when you're doing this work, because number one, it kind of highlights what you're at, but also it's really important to get what people really want. Now, the WHO talk about approaching this work through, they call it 4 avenues of influence. And Eilish, you can go on to the next slide there. So this is a good representation of the 4 avenues of influence. They talk about the physical work environment, which actually you spoke about a lot in your feedback. This personal health resources, right-hand side, enterprise and community, bottom circle, and then psychosocial work and environment in the left. So just a moment on those 4 pillars. The physical work environment, a lot of what you said in your feedback, and it's probably the most obvious one in some ways, the light, the space, the colors, the air, the comfort, the furniture, the place where you can go for a cup of tea, your desk, the kitchen, how cold or hot your workplace is, places to relax, places where to go if you're stressed, and the inside and outside space. How do you make that as health promoting as possible? And we would always say in health promotion, how do you make the healthy choice the easy choice for people? It's not about individuals having to do everything, it's the environment supporting the individual. So the physical work environment is often the most obvious and the one that we see most probably in our work. In the personal health resources, then that's all about kind of health education, supporting workers to be as healthy as they can. That could take the form of meditation classes, yoga classes, steps to health initiatives, smoking cessation, physical activities. So that's really kind of focuses in on the personal health resources of all of us. And lately, I suppose we've done a little bit more during the pandemic. We've had an awful lot of resources through health promotion on stress and meditation and physical activity, etc. So how does your workplace help you there? The environment, the enterprise and community involvement, that's a little bit more about how do you link your workplace into your environment? How do you link into local authorities in relation to what they might do to help you? Charity groups, planners, the family and community groups. How does the workplace link into those community structures so that the workplace impacts the community and the community impacts the workplace? That's not as clear probably. Then the other one, the psychosocial work environment. You're really talking about the felt sense there. And you said that. You said, what does it feel like? Does this feel like a place where people feel valued, that they feel a sense of worth, that they have clear roles? How do staff relate to each other? Do they like each other? Do they work well with each other? So that is really, really important. And it's very hard to write it up. It's just so important. Actually, often in the COVID times, we heard a lot about how staff said, God, we really pulled together, you know, to get us through. That's often underpinned to that psychosocial work environment by really strong policies. You really need to watch the policies on dignity at work, healthy eating, mental health, sexual health, etc. So that area will be underpinned by good policies. The circles in the middle, Eilish is going to do much more on those in the middle in a few minutes. The inner circles really are where the Wellbeing at Work Committee does the practical work. So those outside things are kind of the bigger WHO approach. And lastly, just there's a slide here that we put together from different work groups, and a lot of what you said came up. These were some of the things that people were doing in their workplace, and it's just done in a word puzzle: meditation spaces, bike to work schemes, quiet places to be able to go to, walking routes, smoking cessation, outdoor area, how nice is the canteen. The choirs are in there. They've been really strong lately. So there's some real life ideas that came up as well. So that's the wider context, the WHO context in relation to health promotion and health promotion as a setting for health. So I'm going to hand over now to Eilish because she's going to talk you through in detail the toolkit, which you're all waiting to see, I know, but thank you for your time in that. Thank you. Eilish, you're on mute.
Thanks so much, Adele. That was great. So yeah, we're here at the toolkit. Some of you might have seen this already because we did give an option for you to download it when you registered. But if you didn't avail of that, we will be emailing out a PDF copy to all of you as well. So don't worry, you will get your hands on it very shortly. So I suppose in terms of the toolkit, where it came from, it really was just this working group coming together and identifying the need for really a document that was like a one-stop shop, that it would have everything you need if you had an interest in setting up a committee and wanted to know how to go about doing it successfully and developing an effective program that was sustainable and was going to make a good impact in your workplace as well. So that's what we've done, and we think we've done a good job on it, but we wait to hear your feedback, and we would really appreciate your feedback when you do start to use it. We haven't printed this as a print document yet because we wanted to get feedback and edit it and modify it and make it as good as it can be before we go to print as well. So when you do get to use it, please feel free to feedback to us in terms of what works, what doesn't, what else you might like to see in it, because it will be an ever-evolving document. So in terms of what's in it, this is just a quick, a quick overview, but I am going to just share the actual document with you. But just to give you a sense, you know, it's a step-by-step in terms of setting up a successful program. And even for those of you who have programs set up already, this is still useful to kind of look at those steps and make sure that you've kind of followed along. You might pick up some tweaks or some things that you can do to improve your program, even by looking at that. And there's lots of ideas. We wanted to make this as practical as we can. And there's some case studies from HSE settings, which are really, really useful too, and give you some great ideas. And I'll share some of those with you as well. And then there's lots of tools and resources in it. This is the kind of the done for you section. And we have business cases done in terms of reference, needs assessments, and so on. So the best thing is actually just to share the document with you. So I'm just going to pull it up here and walk you through it. So this is the document, and you can see that inside we have all our contact details as well. So I know we did a quick introduction at the very beginning, but just in case you want to reach out to us, our emails and our phone numbers are in the inside page in the document. We also have a welcome from Priscilla, who you met earlier. So the key page here is going to be your table of contents, because this is a document. It's not something you're going to pick up and read from front to back. It's more of a reference guide or a reference document. So when you're looking for ideas, let's say on physical activity, you can come in, go to initiatives and look at physical activity. If you're looking for, you know, a sample terms of reference for your group, you can come in and just go to that. So this table of contents is probably the most useful section for you, because you'll be able to find what you need. So I'm just going to go through page by page and very briefly, and you can get a sense of what's in here. So we have the introduction, which is what we've kind of addressed today in terms of the benefits of workplace health. And we also have a link back to what Adele shared with you in relation to the World Health Organization Healthy Workplace Framework. And you can see her 4 pillars there, and then the steps that Adele alluded to as well. And these steps, as I said, whether you're an existing committee or a new committee, are really important to follow along to. These are the evidence base. You know, if you follow along to these simple steps, you're going to have a successful program at the end of the day. So the first one here is mobilize. And for those of you who, as I said, are already established, you probably have gone through some of these steps already. But the key thing here is to get management buy-in. You really need that from the outset if this program is going to be successful. And more than anything else, really, I think from all of us in the team, we would all agree that senior management buy-in from the outset is the most important thing here. They have to be behind you, and it has to come from top down as well as bottom up. Then setting up your committee. Ideally, this is going to be a cross-section across, you know, various different services, departments, and within your organization and within your workplace. And we have a sample terms of reference in the document for you as well to help you establish some guidelines and guidance around setting that group up. Then the next step is to assess. You know, we all might have these great ideas in terms of what our workplace might need, but it really is important to go out and ask the staff. And there's many ways you can do that. It could be focus groups, it could be suggestion boxes, it could be a Survey Monkey questionnaire. And again, we have sample ones of these in your resources section at the end of this document for you, again, just to make this easy. And then to prioritize, you know, probably getting lots of feedback from the suggestion boxes, but it's, you know, you're not going to be able to do everything. And we do recognize that you all have full-time jobs. You know, if you're taking on workplace health, it's usually an add-on to what you're already doing. So it really is important just to, you know, pick a few things and do them well, not to try and kind of change everything overnight, and build on that year on year. And it's also important to kind of make sure that the work is shared between everyone. If there's one driver doing everything, it's not sustainable either. So you want to make sure the work is spread out as well. So from that, then you just set out your plan for the year. And again, we have a sample plan in the back for you, and then do it. And that's where the fun part is, as it says, you know, actually going out and doing the initiatives. And, you know, as many of you commented earlier, those of you who do have staff health initiatives, there's so many benefits from doing it. And so that is the fun part, when you're seeing staff out there enjoying themselves, getting involved, getting engaged, and hearing the laughter in the corridors again, that kind of thing. That's what we're after. And it's always important to keep evaluating what you're doing, keep trying to improve it as well. And again, at the back, we have evaluation forms. So we've tried to think ahead to everything you might need, and to save you the time of having to kind of come up with terms of reference, come up with evaluation forms. We've put it all there, done for you in the back of this document. So some other sections on there, there's sections there on just communication tips, how to get your message out to staff. There's a little bit on the wellness champions that you're going to hear about later. And then we have lots of ideas, because we wanted, as I said, to make this as practical as we can for you. So we've gone out to the wider health promotion improvement team and asked each of the specialists in these areas to come up with some good tips for you and some good links and resources for you in relation to each of these areas. So the dietitians have come back with lots of ideas for you here. The physical activity team have come back with lots of ideas, and they've actually developed a whole toolkit around physical activity, which we'll talk a little bit about earlier, which is going to be a fantastic resource for any of you that are interested in getting your workplace more active. Mental health, lots of stuff going on there at the moment, and lots of need for that at the moment as well. So you can get lots of great resources there in relation to the stress control programs, minding your well-being, and so on. So some great resources. And similarly, again, from our fantastic sexual health team, put together some great ideas there. And they've had some great webinars happening recently, one on menopause and one coming up on puberty. So very active and dynamic team. And similarly with the smoking cessation and with drugs and alcohol. So very practical in terms of ideas. But probably my favorite section here is the case studies. And I know many of you who've contributed to these are on the call today. So thank you so much to Blackpool, St. Finbarr's, UHK in Tralee, and Kanturk for submitting their case studies. And I think this is really nice because we can learn what works in other HSE settings. These are employees just like us, staff just like us, and environments just like us, and they're out there, they're doing it, they're rocking it. And so it's really inspiring to the rest of us to see what they're doing and how we can learn from them. So things like Blackpool, a whole range of ideas. You know, I love the water bell. They have a bell that is rotated around, and every time it rings, it reminds us to drink, or reminds them to drink. And so things like that, you know, simple little things. And quite often it's the simple things that don't cost anything that are the most effective. And St. Finbarr's had lots of stuff as well, from bike schemes to walkways to health to staff choirs. Again, the choirs took off over the last couple of years, and we have one in my own workplace in Rathas, and it's just been wonderful to meet staff from other areas that I'd never engaged with otherwise. It's been really, really nice. UHK have done a lot around physical activity and got the Irish Heart Foundation Award for that. And so again, loads of great initiatives, from step challenges, which is coming up soon. And again, bike schemes, walkways, soccer, and so on. And then Kanturk have done some fantastic work for charities, which is fantastic to see. And they're looking forward to getting set up with a polytunnel for staff and residents to use as well, which is really, really exciting. A lot of stuff that came in this year to our staff health grants were in relation to outdoor spaces. Not surprisingly, in the environment that we're in at the moment, but you know, creating nice outdoor spaces for people to go, and gardening obviously is a really nice part of that. So we love to hear your case studies. So hopefully those of you who are new or setting up, we'll be adding more case studies to this document. As I said, it's an evolving document, so we look forward to hearing your ideas and what you come up with as well. So the final section, the toolkit, then, as I said, are the kind of the done for you pieces, and I'll just quickly run through those. And the first page outlines some supports that are available to you, but we'll be discussing those later. The business case for Wellness at Work. So if you're trying to engage management, which we really encourage you to do from the outset, and you need to go to them, you know, this is a 2-pager that might be helpful to you. We're also looking at developing a presentation to management that will outline kind of the benefits of staff health, why they should be engaging, why they should be supporting. So we can provide that to you or help you with that. In terms of reference for your committee, just sample there that you can use. If you're doing a needs assessment, this is a cover letter and a questionnaire that you can use. And again, we can provide all these to you in Word docs as well. Focus group, sample questions, fundraising ideas if you need to go down that route to generate some income to run some challenges. Your sample action plan, again, nice and simple. It's all about keeping this simple and easy for you. And then evaluation form, both for participants in terms of the initiatives that you run, but also for the organisers. So you can learn from what you did, what worked well, what didn't, how you can improve on it, and so on. So that's the toolkit, and that covers everything in there. If you have any questions on it, feel free to put them into the chat box, and if you can just keep adding them in and we'll address them at the end. I'm going to pass you over now to Katrina, and she's going to talk to you a little bit more about those supports that I mentioned earlier.
Hi there, this is Katrina here speaking. There are a wealth of supports and resources available, and I think lots of people don't know how much is available. And just up there, there's the first one is the Well Done Day that was run last June for staff health and wellbeing, and that is on the there's like now. So that's on the, there's a link to that, and which you can look back on. There were health related sessions. And gardening and parenting, a cooking demo and physical activities if you want to look back on that. Then there is Cork Kerry, Ailish, there's a picture of Ailish up there. The Cork Kerry Community Healthcare has a YouTube channel with a dedicated staff wellbeing section. It hosts a number of videos on staff wellbeing, including mental health, physical activities and minding yourself. The next one up there with the money sign was that we ran a very successful staff grant scheme last October, November, and over 60 Wellness at Work committees received grants for staff health and wellbeing, and we really are hopeful that that will be able to take place again this year. But you have to have a Wellness at Work committee at work in order to do that. Fourthly, there the resource, a wellbeing at work resource. This is a resource which includes information on internal supports available to staff and Cork Kerry Community Healthcare, including health and wellbeing, employee assistance programme, occupational health, human resources and financial wellbeing. It's like a one-stop shop, which is very helpful. And finally there, every October, Cork and Kerry run a mental health and wellbeing fest for a week in October. And there are free online, outdoor and radio events that week, which is very, very interesting. And there are numerous other supports, but this is a flavour of what's available. I want to hand you over now to Mara, who's going to talk about the Wellbeing at Work newsletter, which is really gaining momentum and is fantastic. Thanks.
So this is our Wellbeing at Work newsletter, and we release that once a month. And I suppose this is a fantastic resource for you, both personally and also professionally and to support, I suppose, the workplace committees as well. So it's filled with loads of articles, really interesting articles on health and wellbeing, covering physical activity, mental health, gardening, finance. We change them really, I suppose, and try and make them relevant for either time of year or for, I suppose, where we're at the moment. So things like there'll be recipes, different tips, but I suppose within it as well, we have an opportunity to profile services and to profile staff, and we'd really invite you, I suppose, to send in submissions on those areas. But I suppose it's also a really good resource to keep you up to date on what's happening both locally and nationally. And for you as part of a wellbeing committee, I think it'll be a really, really good resource to support you in that. So I'm going to ask anyone who would like to submit anything, you can send them in to me, and the emails will be is available on the actual toolkit. So thank you.
Hello.
Is Caroline there?
So Adele, you're good to talk.
Yeah, sorry. Yeah, Ailish. Yeah, sorry. Caroline's line has gone down, folks. The joys of webinar working. So Caroline was going to do a bit on the work champions. So just to talk a little bit about the work champions, and I'm going to kind of read what Caroline sent me just there now. So basically, by attending today, you've taken the first steps to becoming a champion if you weren't one already. And we have a number of champions. So just first off, to acknowledge you if you're out there in this group. Thank you so much for your work to date. And so our plan as a team, the Wellness at Work team, is to try and reinvigorate that existing champions group and to grow the number of champions that might be available to do this work. And to be a champion, all you need is an interest in staff health and well-being where you can influence change. So the team here believe the champions have a key role to play in improving wellness at work, bringing the message to local groups and ensuring we hear about staff needs locally. So they're really, really important. They're on the ground people that are really important for this work. The role is in addition, if you were to become a champion, the role would be in addition to your current role. So we have no intention of overloading you because we know how busy people are. What we want is for you to be a link for information, to be visible and active in your workplace promoting health and well-being. That's really what it's about. And as a team, we plan to support you by equipping and assisting you in your role by giving you information to signpost staff to existing resources, to link with you as our first point of contact for upcoming events, to listen to feedback from you and your workplace. And our next plan is to, we're hoping to hold a biannual webinar to link champions from different sites, allowing for shared learning. And in my work to date, anytime I meet with my colleagues where we get to share, what are you doing? How did that go? How did that work? So that kind of, that network, we basically would hope to set that up. We'd have 2 of those webinars a year where people could come and say, this is what we're doing, how is it going, how did you do that? All of that sort of rich stuff that you get when you get to meet. So I hope if you would like to be a champion, contact any of us on the committee and we'll be really delighted to support you with the work, including obviously the work that's outlined in the toolkit today. So Ailish, I think it's back to you now from that piece. Thanks, Ailish.
Thanks, Adele. That's great. So I suppose that we just wanted to finish off with one last little breakout room, and I think you've got a good sense, I suppose, of what's in the toolkit now, what other supports are available to you. But I suppose this is our way of doing our needs assessment in terms of finding out from you directly what kind of supports you might need moving forward. So maybe there's something we've missed, maybe there's something that we've done but you'd like to see it done differently. So we'd really, really appreciate your feedback here in terms of how we can best support you moving forward, whether it's you want to set up a new committee, whether you're an established committee but want to kind of progress things, whatever it is, wherever you're at, and we'd love to hear from you. So again, we're just going to go into breakout rooms and we will get some feedback from hopefully each of the groups at the end, or most of you anyway, and we really appreciate that. So I'm just going to open up the rooms now, click to join your room, and after about 5 to 8 minutes we'll be coming back to the main group again. Okay, so I think most of us are back from the breakout rooms now, so hopefully you had some good discussions. I'd love to be flying the wall in all of them, but hopefully we'll get a good sense from you now as you feedback from your groups in terms of how we can best support you moving forward. So who would like to kick off from their group and share some of the ideas? Just remember to unmute yourself, and we'd love to hear some of the ways in which we can support you moving forward.
Ailish, I don't mind kicking off. I'm not sure what number group I was in, but one of my colleagues in our group spoke about the fact that one of the high leads, one of the health and wellbeing team, visited their establishment, and they felt that gave it kind of a lot of oomph, you know, when they were kind of coming back to management, which and as well as that was also fresh eyes, because we all tend to get more, you know, complacent, and not in a bad way, but just like, it's like, you know, we paint a room, you don't see it after a few weeks kind of thing, you know, but so a fresh eye is coming. And as well to bring the HI, maybe what, you know, observations, and with the team, with the staff on the grounds to management, they felt it had more oomph if it came kind of from the health and wellbeing team. Well, another colleague brought up, but I'm going to bring it up at the Q&A later, about that maybe with the whole you know, initiation or enhancement of wellness at work, safety issues, for, like she said, with people post to COVID, like people are stretched to their limits, and just safely, maybe more mental health support. But I reassured her that the toolkit has lots like sites like the well-being videos, that there's lots of support in the toolkit, but to come back to us if need be, kind of thing. That's kind of that was what we had from our team.
And actually, I did, thanks, I mean, it reminds me to mention, because I didn't mention when I went through the toolkit, and when I'm saying it's a one-stop shop and it's everything you need, you also do have the support of the team here as well. We're not just giving you a toolkit and going away and do nothing for the rest of the year. We are here to support you as a team, to have promotions through the Healthy Ireland Leads, and we're here as a resource, we're here to guide you, we're here to help you in any way we can. So that's part of why we're delighted with all of you coming onto the webinar today, because you can put a face to the name. It's a lot easier to reach out and contact us hopefully now, and that we to know that we're here to support you as a team. So thanks, Anne-Marie, appreciate that. Adele, you were going to feedback from your group?
Yeah, basically they thought the idea of the network was a good idea, and that it would be, am I talking over you, Eilish?
No.
Okay, sorry. Okay, practical ideas. So the network would be really good for practical ideas, like what other places people are doing. An update on support. Somebody said that they wanted that. Management support came up again, and that was just that it's really, really important, and that there would be maybe protected time for meetings. If you're on a wellness committee, that we'd be trying to have protected time for that, because otherwise, that could cause difficulties. The other thing was, no, this is, we want money. If the grants were mentioned, and they were mentioned favorably, but the question was, are we going to have grants again? And everybody would like some more money. So I'm not sure about the grants for this year, and while we joke, it is really important. We had some great grant applications this year, and I was saying we got great ideas from that as well. And I think that was it. Yeah, the network, they wanted to be practical and to have practical ideas and sharing of ideas.
Fantastic. Yeah, that's fantastic. I don't know, Priscilla, do we put you on the spot? Do you want to add anything or to answer the queries that come up from Adele's group regarding the staff health grants?
Absolutely.
Feedback.
Absolutely. So no, you can put me on the spot, Adele. Look, I think that's fair enough. The group I was on as well. I mean, show me the money obviously would have come up in every group. So certainly it is a need to support what the committees need to do. Just to let people are aware, I certainly have put in a proposal for an increased budget again for this year, 2021. I haven't got confirmation as yet, but certainly it is looking favourably. And we have a local meeting next Monday with our own management team, whereby I'm going to be asking for a front loading on that so that committees can actually start sooner than later. So I don't have confirmation as yet, but I'm very positive that we will get the funding. I know that there is questions coming in from other entities, if I may, please, Eilish, and that is in relation to, so my remit obviously is for the budget that I acquire is for the Cork Kerry Community Healthcare and the care groups and services within that. But just to say that we work very closely with our colleagues in acute hospitals, and we are putting a process in place in terms of the funding stream there and the accessibility around that. So look, hopefully within the next, I would say, 2 to 3 weeks, we should have a more confirmed position, and I can certainly get that out via yourselves.
Thanks so much, Priscilla.
Can I come in there, Eilish? Sorry, on that point, if that's all right. On our group that came up about the COH and the activity within the COH. I was just, Fiona, if you're online as well, Priscilla, the contact there in the COH for that committee is Dr. John Gallagher, is that correct?
Well, John is the chair. John is the chair in terms of trying to establish an overarching one, and he's got the support from senior management, and he's invited me onto the group. I've been participating for the last number of months with them, but they actually are looking. They're going to actually have a recruitment process for an individual to take that remit within the hospital campus, and they'll be engaging with the well the Well at Work committee and our supports. So once we have a contact, there will be a named contact for that committee. I put it up on the chat there. In the coming weeks, there should be a confirmed person, and we'll get that out to everybody. I'm conscious, Sharon, that there is committees already established in CUH.
Yeah.
So this won't be duplicating anything that's pre-existing. It's actually to support what's there, but also to develop in areas where there's very little happening. So certainly it's not to duplicate anything that's in place already. It's really to support it and to ensure that a funding stream gets into that very large campus as well.
Exactly, great, Priscilla. Thanks for clarifying that. Ailish, do you want me to go through our group?
Sure, that'd be great, Sharon, while you're there. Yeah, thanks.
Yeah, so we had members from our occupational health department where that query came from, so that's great that you've been able to clarify that, Priscilla. Also disability services, occupational therapy, and ourselves in health promotion. So one of the key pieces that came back was the toolkit as a support, so that is really helpful, and out of that came the, Adele, you were mentioning it earlier on, that network piece. So if we can facilitate the establishment of some sort of a network where, for example, if somebody's in a workplace and they think of an idea, if they have a sense of what's going on across Cork and Kerry already, so that they can connect in with the other person and they could possibly share work and share experience. So that was important, and we felt that for a while, that the workplace champions, the newsletter, it's all about building up that network, and obviously management support was mentioned, so that's really important. And it's like management support within the site, management support across Cork and Kerry, so that's on a number of levels. We had a couple of suggestions in terms of protected time. Somebody also asked in terms of if we could circulate a list of the committees or maybe even the contacts, again around I suppose that would be around creating that network, and so as well as in terms of a particular sites having suggestion boxes in the work site in terms of how can we improve our workplace health. So yeah, that was it from our group.
Great ideas there, Sharon, thanks so much. And a lot of overlap as well between the other groups. So maybe for the next few groups, and if there's anything that hasn't been mentioned already, because it sounds like a lot of the similar issues are coming up in each of the groups. So if anyone has any ideas that come up that haven't been mentioned already, we'd love to hear those. Don't be shy.
Ailish, just for, I suppose, something that did come up at the start of our group, as well as for new people, I suppose, that are just embarking on this, and the toolkit would be fantastic support for them, but it's just that opportunity to share and to learn from other services as well. So I suppose, as we go forward, the network will be really, really useful to support that. If you're brand new, how do you actually get it going? I suppose that was something.
Absolutely. So the network seems to be the biggest thing really coming from all of this. Yeah. Thanks so much, Maura. Anything else? Any last one or two things that haven't been mentioned already, or have we touched on most of the issues that come up in your groups?
Ailish, hi, sorry, it's Caroline Fagan here. Just one of the things that came up here was in our group was just keeping the definition of support as sort of wide as possible. That, what supports we need now may be different to the supports that we need in a year's time or a year ago. So just keeping that quite organic and just keeping it as wide as possible. The more champions we have, the better. Obviously, we talked about the top down and bottom up, that it's not just from management down, but that everybody is involved and that everybody is on board. So
yeah, fantastic. Thanks so much for that. So some great ideas coming through, guys. And so if there's nothing else, or there's anything else you think of, please feel free to pop it in the chat box, because it does really, really help us. It is very useful to get the feedback. So I'm just going to go back and I suppose try and tie this all together at least. So in terms of moving forward, I suppose we a few things we kind of preempted there a little bit, but the network, definitely from the feedback you're giving us, it sounds like it could be really useful for us as a team, but also for networking with other areas, so we can learn from each other. We can understand your needs and we can hopefully deliver on them, but also that you can learn from each other, that Rathas can learn from what's happening in CUH, or, Skibbereen can learn from what's happening in Killarney. So we can all share ideas, and I think it sounds like it would be really, really useful. So I think as a group, we'll go away, we'll listen, discuss the feedback that we've had for you today, but I think the network definitely sounds like it's one we had thought about, but it sounds like it's definitely one that there's a need for there. protected time is another one that came up a good few times. The grants come up, and the support from management. So they're kind of things that we'll keep in mind and look at how we can best support you in relation to those. I suppose with the grants and with the other ways of communicating, the network will be a great way, but also we will follow up with you. We do send out emails to all the wellness champions. So that's one good way, if you're not already registered as a wellness champion, to get in touch with Caroline and register yourself as one, because that you'll get all the up-to-date information. And also, as Maura mentioned earlier, the newsletter is a great way for us to communicate with you, but also the other way around. And Maura's always looking for content, and that goes out every month, and it's a fantastic resource. She's done a brilliant job with it. And you hear about upcoming events, new resources, what's happening, the grants will be announced there, all these kind of things. So it is worth making sure you're on the mailing list for the newsletter, and you'll get that directly as a wellness champion, but you'll also receive it through the broadcast. So we've definitely lots to think about, and definitely lots that we hopefully support you with in the future as well. So thanks so much for contributing all those ideas and suggestions. Just before we finish up, we will have time for Q&A if anybody wants to stay on, but before we finish up, I just want to mention another launch that's happening next week, and this is through our physical activity team in HPNI, and they have developed a fantastic resource, and it really complements this toolkit if you have a particular interest in physical activity. So again, it's a one-stop shop when it comes to anything to do with physical activity in the workplace. So they've done a fantastic job in it, and they'll be launching that next week. So as I said, more and more resources coming out over this past while for you, and there will be more and more coming. So that's one to keep in mind. It's clare.dc@hse.ie if you want to register or get further information on that. And as I mentioned earlier, Anne-Marie, are you going to jump in here? Or keep going, just to mention that all our contact details are on the inside page of the toolkit. So if you do want to reach out to any of us, you get us here. And Anne-Marie, there you are. Anne-Marie, you didn't get to at the beginning, so would you like to say hi?
Again, sorry, thanks, Elish. My sound went down earlier. I'm Anne-Marie, a nurse, and the link in the older adult services. And as Elish pointed out, we're not just dropping the toolkit on you, which is a fantastic resource, very simplified, very step-by-step. But we're also at the end of a phone, at the end of an email, and as Elish clearly pointed out, page 1 of the toolkit. And like that, if you feel anything else in the toolkit, if you need something else, please don't be afraid to tell us. We can all, like it's a document. We can add or subtract, hopefully as we go forward too. Now we're coming. You might be glad to hear we're coming to the end of our launch, which I hopefully was very informative. And we have some maybe 5+ minutes for any questions and answers. So I have been having a peep at the chat box myself, and it was lovely to hear Priscilla so positive, and Sharon to speak of the COH. That's really where we want to go. Like people to take the initiative to bring so many departments together as one unit, and to face wellness at work, to see it, to focus on it. If we don't focus on something, it won't develop. So it's fantastic to see the likes of the COH, and hopefully other bigger hospitals like the Mercy, I won't mention names, and in Kerry will follow suit. That's the hope, that's the intent. So it's fantastic news. And one of the questions that I picked up from the chat box, and I might just throw it back to the team, was where does staff safety fit? Staff safety, and the example when we further investigated was in relation to, say, like with COVID, there's been a lot of overload on staff, from the extra work, maybe duties extra, their teams have changed, maybe working longer hours. Where does staff safety fit? And I was able to reiterate or reassure her that the toolkit had loads of like the Wellness at Work webinars. They're online, but they are super, informed, and hopefully in time they may be in person. But if any of the rest of the team might like to throw something in there that might help them, might help this email, please do. I hand it over to my team. The question is, where does safety sit in the framework, in the whole health and staff safety? Yeah. Has anyone anything to add?
I think you've answered it yourself there, Anne-Marie. You were discussing it, and I suppose being part of that group, you're kind of more in tune with the context of that question. So I think you did a good job on that. I just want to mention also, Maura has put in the chat box a link to a SurveyMonkey questionnaire. So it's very short, very brief, few little quick questions, just to give us some feedback on the webinar today and how we might improve it moving forward. So if you wouldn't mind, just click on that link, the SurveyMonkey, in the chat box, and that would be much appreciated. and it just takes a couple of minutes just to do that. So if there's any other questions? Yeah.
There was one other question, sorry, from the chat box, and I'm sure like that, how to apply for the grant. Like Trina mentioned there, that we're very much welcoming new, like you don't necessarily have to have a committee to source the grant. We're very, very, very much encouraging new, all hospitals. Health and wellbeing, as Priscilla mentioned at the outset, is for everyone. Like it's up to, for ourselves, we have to really, push this at our own campus level kind of thing. So how do you apply for the grant? I'll hand it to the team just to give myself, if anyone wants to.
Thanks.
How to apply for the grant.
I suppose just to clarify there, we did have that you did need to have a committee, but you could be a new committee. You could be newly established.
Yes, that's what I meant, yeah.
Yeah, because we do want to have the context and the support there rather than individuals going out and doing things. Having the committee definitely, we know from best practice is the way forward. So having a committee, whether it's new or established. As Priscilla said, we'll know within a couple of weeks if we have the grants. If we do, as a team, we're ready to rock and roll. We have the forms prepared, we have the criteria prepared, we have everything they're ready to go to send them out. So we'll be in touch. Really, that will be sent out through broadcast, and we'll also be in touch with everyone who applied last year, and also with the Wellness Champion. So becoming a Wellness Champion is a key way to be up to date with information from us as a team, because emails go directly to all the Wellness Champions, as well as through broadcast. So that is the best way. And just to, Caroline, you might put your email in the chat box if anybody does want to get added to the list as a Wellness Champion. Just email Caroline, and she'll set you up. So Caroline's going to put her email there in the chat box for everyone. Thanks for that.
Priscilla may have a question, Elise.
Sorry, I just wanted to, I suppose, absolutely, I will revert in terms of the overall funding for the grant process that we hope to implement that was so successful last year. But I would just like to say I wouldn't let that be a stumbling block, because there is a commitment locally in terms of developing healthy workplaces. So I would actively encourage people to start looking at what they require in order to aid them to commence the foundation of a wellness at work committee, or what would help in their environments. And in one of the chat rooms that I was in, I did say, if obstacles come within your guise of trying to develop this, I want to know about it, because I want to remove any barriers that any individual or group of individuals or workplace committees in their troves of trying to develop and get going, anything that is a stumbling block for you, I want to know about that so that I can try and resolve that with the appropriate line managers.
Thanks so much, Priscilla. And can I just add there as well that really, to be honest, in my experience, I've been involved in workplace health for about 20 years now, on and off over the years, but some of the most effective and most fun and most engaging things with staff are free things. It really, not everything costs money, and sometimes the things that cost money are the things that aren't sustainable, because it's paying for an instructor to come in and teach an 8-week class and then they're gone. So really, it's about getting creative as a team and getting ideas from your staff and thinking of other ways, and also use your own staff as resources. The amount of yoga teachers that are probably in your building, or Pilates teachers, or people who could do, if dietitians might even be there doing a cooking demo. So look at using your own resources within your own staff as well. And so, yeah, it's about getting creative, and it's not all down to, oh, we can't do anything because we don't have money. It really is just about getting creative, and we're here to support you with that. The toolkit has lots of ideas, and lots of them are free. In the toolkit as well, and even the case studies that came back from the HSE sites for the toolkit, the majority of those were free. And there's also lots of resources coming down nationally. The Steps to Health Challenge, you get everything you need for that just sent to you. We're in the process at the moment with National Staff Health and Wellbeing of developing a series of online Pilates, yoga and strength and conditioning classes that will be made available to you in the coming months. So there's lots more and more free resources out there, and we're happy to guide and direct you towards those as well.
Can I just add in there, sorry as well, Elise, I'm I'm biased in mentioning Kanturk, but the likes of Kanturk, you can see they did a lot for charity as well, and all free as such to them. It was fun. They clothes, they gathered clothes. Not even just what they did, but as a team, once the momentum initiated, it kind of grew, it spread, it got wings. And they're presently walking virtually from Mizzen to Mellon to raise funds for a local air ambulance. So those kind of things as well. It isn't even all, they're all fun, and it just takes the focus so much of, on the ground, the work still goes on, but it's lovely to go to break and maybe talk about other things outside of, outside of work. And brings the morale, it enhances the morale, the boosts the morale, and that's what you want. Like we mentioned about the felt sense when you walk into a place. If the camaraderie is good, everyone benefits, kind of thing,
Absolutely, Anne-Marie. Caroline, there's a question there from Aoife in relation to what's involved with being a wellness champion and what's the commitment. Would you mind speaking to that one, Caroline?
Hi everyone, sorry I lost my connection. I had to completely close out and come back in again. So I suppose we acknowledge that everybody has a job. So this is an add-on, so we don't anticipate overloading anybody with extra work. I suppose what we want from champions is for them to be a conduit for information so that we can feed information down and that staff on the ground can let us know what they want. So that's the main thing, and I suppose it's just to be visible within the organisation or within your setting or health centre so that people know who you are, and we have a kind of a plan around that. We'd like to have a photo of the health and wellness champion and maybe a certificate in the canteen areas so that people know who you are and know who to come to. So that's really basically it, and we do want to, I suppose, have a network of champions as well, and our plan is to have kind of biannual webinars so that we can link champions to get ideas on what's working and where we can improve.
Thanks, Caroline. Hopefully that answers your question there, Aoife. Just another one from Cassie, just saying that a lot of stuff happening in Cork, someone working in a busy office in Kerry should like to see more opportunities. Well, I'm Kerry based, Kathy, so get in touch with me, and I'm not sure where you're based, but I can try and help and direct and support you to things that might be happening. There's another question then, maybe Adele, you might respond to this one in relation to the grants.
Red tape.
Mm-hmm.
Was it the red tape question? Yeah, I was looking at that. Could a framework be established so that we know what to apply for in the grants, please? Faced a lot of red tape as regards companies we could order from. We were aware of that actually in the background last year. We did have categories under which you could apply, so we might try to be clear on that. But the main feedback we got, and we may need to do more work on this, is there was kind of confusion financially. So one of the main things you need when you're applying for the grant is to have a financial person who knows the run of things very well in relation to who you order from, where you can get things ordered from. We're looking at promotion. Our finance person knows a lot of that. So that's not answering your question directly, but it's really important when you're applying for grants this year that the finance person that you're putting down as the link knows a lot of that stuff that you might know that I often forget. And that's really important. The finance person that you put down, they are kind of very keyed into financial issues and who you can buy from and purchase order numbers and when people are registered or not for HSE. So it's not answering it directly, but be really careful when you are coming in that you have that solid financial person there to help you.
Thanks so much, Adele. Caroline, just another one there in the champions, and Fiona's just asking, is there training for champions?
At the moment, no. I suppose we have included a piece on the champions in the toolkit, and the toolkit will be going out to everyone that's attending the webinar. So it kind of gives the premise for why we want champions. Again, it's like the vastness of the HSE and the size of it. There isn't training, but we do hope to, I suppose, develop the role of the champion, reinvigorate our existing champions, and I suppose that is something that we will be thinking about down the line, and especially the webinars, I suppose, will give us some more information on what we need to do.
Yeah, and I suppose we can always respond if there's a particular need around training in a particular area. We'd be more than happy to offer that. We're health promotion people. We love delivering training. So I think that's it.
There was one more question in the box there about the toolkit, but it was answered anyway. Just that everyone that's registered in today's webinar will get a toolkit.
Thanks so much. Thanks, Anne-Marie. So thanks so much for all the engagement today. You've just been fantastic. It's been great, all the chat box activity, the break room activity, and so thanks so much for attending and participating in it, and giving us lots of great ideas and suggestions for how we can best support you moving forward as well. So we really look forward to working with you over the remainder of the year and beyond, and delivering what it is you need. So as I said, you have our contact details. Do get in touch, and we'll be sending out the toolkit to you as well in the next day or two. So I'm just going to ask Sharon Parkinson just to pop back on and just close off the webinar for us today. And thanks again to everyone.
Thanks very much, Ailish. I do a very, very brief summary, I suppose, is that just to thank the team for a really interesting webinar. From Adele's visualization, I think it's a really good way to look at it. There's so many different factors that affect our health in work, on so many different levels. And I suppose like that, it'll be clear from today that as a committee, we take a broad approach, and it's a broad definition of it. So it's, we're putting initiatives in place like that, the grant scheme to support you in implementing a more positive physical environment, giving you the information in terms of what supports are there for you. I think a really important piece is, like we're saying, that it's on so many different levels, in order to get to where we all kind of want to be collectively, we need to work together. So that network is, and that's very much, we hear that, and we will talk about that more as a committee. And again, just to say, the committee has done a huge amount of work, and to thank you for that. They meet on a weekly basis. I'm really keen, as Ailish has said, to be connected in with you. So now that we're here, please do make contact with us. And we hope for you to be in contact with each other as well. You obviously have the information in terms of what's available, and the newsletter as well. It's really, really good. I really always enjoy reading that every month, so keep an eye out for that. And there we do push all of the updates into that, so keep an eye out. And I suppose what they say is that be the change that you want to see. The network will be important in terms of us supporting each other, but just want to thank you all for your interest and your enthusiasm, because sometimes, like Priscilla said, we do face barriers in trying to move forward positively, but I hope that you'll know that we're here for you. And it's great to hear you, Priscilla, saying that if there are significant barriers, that they will be addressed at the management team level. So thank you very much all for your time, and it was lovely to engage with you this morning.